Okay, so you want to be clued in on restaurant safety,
Right.
but without drowning in all the technical jargon and endless rules.
Yeah, totally. It can be overwhelming.
Exactly. So today we're really digging into restaurant health code violations, inspections, all that stuff. Think of it as your direct line to understanding what really matters when you eat out.
And we've got some great material to work with. It gives a really full picture, from the basic hygiene rules all the way to how inspection scores affect, well, everything, the business, what people think.
What kind of sources are we looking at?
We've got stuff from a restaurant management platform, a scientific paper comparing inspection results to online reviews, which is interesting.
Oh, yeah.
Yeah, and CDC data on outbreaks, plus actual chatter from food service folks on Reddit, also guidelines from a supply company, and info on how you can find these inspection reports yourself.
Nice range. So our mission here really is to pull out the absolute must-know insights for you. Get straight to the point, give you knowledge you can actually use about restaurant health and safety.
Let's do it.
Okay, so let's start right at the beginning. What are health code violations exactly? And why should you, as someone just going out for dinner, even care?
Right. So basically, a violation is when a restaurant doesn't follow the rules about keeping food safe, keeping the place clean, general sanitation.
And these rules aren't just suggestions.
No, not at all. They're there specifically to protect us, the public, from getting sick from foodborne illnesses. And look, the consequences for the restaurant can be pretty serious.
Yeah, it's definitely more than just like a dirty fork. The inspections, that's how they enforce these rules, right?
Right, exactly. And violations can lead to fines, or if it's really bad, they might even get shut down temporarily. Plus, it really hurts their reputation.
That Touch Bistro article mentioned something about that, didn't it? A study.
Yeah, in Los Angeles, it found restaurants that got an A grade for hygiene actually had higher sales than ones with lower grades. Which kind of points to something important.
Which is?
Well, it's not just about dodging bad press. Customers seem to see restaurants with better grades as just better overall, not just cleaner, but maybe better food, better service too.
Interesting. So it's all connected.
It really suggests that sticking to the health code isn't just about ticking boxes. It's tied into the restaurant's actual success. And now, especially after COVID, people are way more aware of hygiene. It really influences where they decide to spend their money.
Right. So it hits their bottom line and it's about public health.
Yeah.
Okay. Makes sense. So we know what they are and why they matter, but who actually makes these rules and who checks up on them?
Good question, because it's not the same everywhere. In the U.S., you've got the FDA, the Food and Drug Administration. They put out this thing called the Food Code.
Sort of like national recommendations.
Exactly. Recommendations, best practices, but then each individual state takes that and creates its own health code, and the states are the ones who enforce it. And sometimes cities pile on too, like New York City and Seattle. They have even stricter rules, and they often make restaurants post their grade right in the window. So it's kind of layered.
Not just one single rule book then. Is it similar in Canada?
Yeah, pretty similar structure up there. They have national rules, the Safe Food for Canadians regulations, but then, just like here, provinces and even cities can add their own specifics. Ontario has rules, Toronto has its Dine Safe program. Again, different levels involved.
Got it. So layers of rules. And the inspectors themselves, who are they?
They work for the same government bodies that make the rules. Usually a place gets inspected, maybe 1 to 4 times a year?
Is that standard?
It varies. That Touch Bistro source said you really have to check your local regulations to know for sure how often it happens in your area. And these inspections, they can be scheduled or they can just show up unannounced.
Surprise. Keeps everyone on their toes, I guess.
Definitely gives a more realistic picture of daily operations.
Now, things have obviously changed a lot recently. How did the whole COVID-19 situation affect all this? Did it add a whole new layer of rules?
Oh, absolutely. The pandemic brought in a ton of extra safety measures, masks for staff, checking employees for symptoms, limiting how many people could be inside.
Ventilation was a big one, too.
Huge. Ventilation, keeping cables spaced apart, changes to how food was served, like getting rid of salad bars and stuff.
There's lots of new things to watch for.
Right. And what's interesting is how different places handled it. Did these new COVID rules actually count towards the restaurant's health grade?
Did they?
It varied, like Philadelphia. They started factoring COVID-related violations right into the main health grade.
Okay.
But then somewhere like San Diego County in California, they brought in the COVID rules, but didn't count violations against the official grade.
Huh. in other places.
Well, in Montreal, for example, the government didn't officially add those COVID measures to the health code itself, but, lots of restaurants there still put in their own extra precautions anyway. So, yeah, quite a mix of approaches.
Right, so even if it wasn't official everywhere, the pressure was still there for restaurants to show they were being safe.
Ah.
Okay, let's get into the nitty-gritty. What are the violations inspectors see most often? Both the classic ones and the COVID-related ones.
Yeah, the Touch Bistro piece had a really handy list of 15 common ones. Let's maybe break down some key examples.
That was good. Start with the COVID ones.
Sure. A big one was PPE, personal protective equipment, either not having enough masks or gloves, or staff not wearing them properly, like masks not covering the nose and chin.
Yeah, saw a lot of that. How do you fix it?
Pretty simple, really. Just making sure you have enough supplies and training staff on how to use them correctly. Seems basic, but clearly an issue sometimes.
Okay, what else pandemic-related?
Not doing employee health screenings. Lots of places required checking temperatures or asking about symptoms daily to keep sick staff home and keeping records of those checks.
Right, the logbooks.
Exactly. Then there was exceeding capacity limits. Restaurants were supposed to post their limit and stick to it, and, related to that, allowing indoor dining when it wasn't allowed.
How did places get around that?
Many shifted focus, got permits for outdoor seating, patios, or just went all in on takeout and delivery, adapting, basically.
Makes sense. You mentioned ventilation before.
Yep, improper ventilation, that was key.
Yeah.
For outdoor patios, it meant not boxing them in completely, letting air flow. Indoors, keeping HVAC systems maintained, opening windows if possible.
Okay, more.
Yeah. Ignoring social distancing rules tables too close, letting lines bunch up. Also allowing self-service stations like buffets or drink dispensers. Many places had to switch to staff serving everything.
And finally.
Just missing signs. The posters reminding people to wash hands, wear masks, simple stuff, but still flagged as violations.
Okay, those all clearly tie back to stopping the virus spread. Now, what about the, let's say, timeless health code violations? The ones inspectors have always looked for.
Right. The fundamentals for preventing foodborne illness. One is handling and storing serviceware improperly. Staff touching the part of the glass you drink from or the tines of a fork.
Ugh.
Plates, glasses, cutlery handled by the edges or handles. Store them upside down so the food contact part stays clean. Another classic, storing expired food.
How common is that?
Happens more than you'd think. Just requires regular checks. First in, first out helps, but also just looking at dates, signs of spoilage. If it's bad, toss it, no question.
Definitely. What about how food's arranged in, like, the fridge? Is there a right way?
Oh, absolutely. And improper food storage is a big one, and for good reason. It's all about preventing cross-contamination. Raw stuff needs to be kept separate from ready-to-eat stuff.
And there's an order in the fridge.
Yeah, a recommended order top to bottom. Ready-to-eat foods, like washed veggies or cooked leftovers, go on top. Then seafood. Then whole cuts of beef or pork. Below that, ground meats. And right at the very bottom,
Poultry.
poultry. Chicken, turkey, because they have the highest risk of dripping juices that could contaminate everything below. Putting them last minimizes that risk for foods that might not get cooked as thoroughly.
Huh. That makes perfect sense when you
Yeah.
explain it like that. What else is on the common list?
Food temperature. This is huge. Leaving perishable food out in the danger zone, roughly between 40 and 140 Fahrenheit, or 4 to 60 Celsius for too long.
How long is too long?
General rule is usually no more than 2 hours. But if it's really hot out, like above 90 Fahrenheit, then only 1 hour. And keeping hot food hot and cold food cold during service is critical too.
Okay.
Then there's poor staff hygiene. Basic stuff, but vital. Not wearing hairnets, not washing hands properly or often enough, working while sick, big no-no, wearing dirty uniforms, even just like handling their phone, then touching food without washing hands.
Yeah, basic but essential.
Totally. And related is cross-contamination in general. Not washing hands, cutting boards or knives between handling raw meat and then, say, vegetables for a salad.
Do things like color-coded cutting boards help?
Exactly. Using different boards for different food types is a great practice. And finally, improper use or storage of cleaning supplies. Using the wrong chemicals, or not strong enough, or worse, storing them near food where they could spill or contaminate things.
Wow, okay, that's quite a list of things that can go wrong. So, shifting perspective a bit. As a customer, you might see that A grade in the window or maybe hear a restaurant didn't do well on an inspection. How much does that actually, sway people? Did we have anything on that connection?
We did. That study from the BCIT Environmental Public Health Journal looked exactly at that. They compared restaurant inspection results, things like hazard ratings, critical violations, with the star ratings people give on Yelp and Google reviews.
What did they find?
They found what they called a negative linear relationship. Basically, restaurants with more violations or higher hazard scores tended to get lower star ratings from customers.
So people might not be reading the detailed inspection report, but their overall feeling about the place, the rating they give it, kind of lines up with the official safety assessment.
It seems so. Now, obviously, customer reviews cover everything: service, ambiance, taste, not just hygiene. But this study suggests there's a real correlation there. It's almost like those review sites could be an indirect way to nudge restaurants towards better safety.
That's fascinating, like crowdsourced oversight almost. Now, what about making those inspection results public, not just online, but like right there at the restaurant? Did we have info on the impact of that?
Yes, the National Environmental Health Association, NE, they studied this, and their findings were pretty striking.
Oh, so.
They found that when restaurants had to post their inspection rating right there at the point of service, a sticker on the door, a grade card inside it was linked to a huge drop, 55%, in reported foodborne illness outbreaks compared to places where you had to go look up the results online.
55%. That's massive.
Right.
Why such a big difference, do you think?
Well, it probably comes down to a few things. Putting the grade right there makes it super easy for everyone to see it, right? You don't have to actively search for it.
Instant transparency.
Exactly. It empowers people to make an informed choice right then and there. And the NAHAV study also mentioned that places using this kind of direct disclosure tended to have fewer follow-up inspections and fewer complaints.
Suggesting maybe it pushes restaurants to keep standards higher all the time.
That seems to be the implication, yeah. Makes the accountability very visible, very immediate.
Okay, so visible grades seem to have a real public health benefit. Let's switch gears slightly again. We also had data on actual food poisoning outbreaks. What does that tell us about where the system breaks down?
Right. The CDC's data from NEARS between 2017 and 2019 had some key insights. First off, the most common culprits in outbreaks: norovirus and salmonella, no huge surprise there maybe.
Pretty common bugs.
Yeah. But here's the really concerning part. In outbreaks where they could figure out the contributing factors, almost 40% involved food being contaminated by a worker who was sick.
40%. Wow. That brings us right back to staff hygiene and not working while sick.
Absolutely. And it gets more specific. While most managers said they had policies for sick workers, a lot of those policies were, well, kind of weak.
How so?
Like, they didn't list all 5 key symptoms the FDA food code says should keep someone from working with food. Things like vomiting, diarrhea, jaundice, sore throat with fever.
So the policies weren't comprehensive enough.
No. And the top factors contributing to outbreaks overall were things like that sick worker contamination, plus issues with contaminated raw ingredients and cross-contamination during prep.
So what's the main lesson from the outbreak data then?
The CDC really stressed having clear written policies for sick workers, policies that list all the symptoms and cover both when workers need to report being sick and when they need to be excluded from work.
Makes sense.
And of course, proper hand washing is critical. Plus, they flooded the idea that paid sick leave could make a difference.
How?
Well, if workers don't lose pay for staying home sick, they might be less likely to push themselves to come in when they really shouldn't be handling food. Takes away that financial pressure.
That's a really practical point. Okay, so we've looked at official reports, studies,
Yeah.
but what about the folks actually working in the kitchens? We dipped into that Reddit discussion. What was the vibe there?
Yeah, that was interesting. Definitely a mix of feelings about health inspectors.
Good or bad?
Both, really. Some see inspectors as helpful, helping maintain standards, keeping everyone safe. But others saw them more as a pain, sometimes unreasonable. There were even a few kind of alarming stories mentioning things like inspectors hinting at bribes or being corrupt.
Wow, okay. So not always a positive relationship.
Not always, it seems. But a really strong theme that came through from many industry people was this idea: your restaurant should always be ready for an inspection.
Meaning?
Meaning you shouldn't need some frantic last-minute cleanup scramble. Good food safety should just be how you operate day in, day out.
A culture of safety, not just a show for the inspector.
Exactly. People shared stories of inspectors being fair and others being, well, over the top. There was also talk about how hard it is to turn around a badly run place, and maybe a link between, like, low pay and bad management leading to failed inspections.
What was the general feeling about failing inspections repeatedly?
The consensus seemed to be if a place keeps failing, it's probably not just about a bit of dust. It likely points to deeper, more serious problems with how the place is run.
Right, underlying issues. So for restaurants that are trying to do it right, what are the key guidelines? That Webfront Store article laid out some best practices, didn't it?
It did. It gave a really solid overview of the core areas. First up, naturally, is personal hygiene. Hand washing properly, and often using hairnets, wearing clean clothes, no jewelry that could fall into food, rules about where staff can eat or drink.
Handling sickness in gloves, too.
Yep. Managing illnesses, using gloves correctly, all that basic but crucial stuff.
Okay, what else?
Proper food handling. This covers the whole journey of the food, receiving deliveries carefully, preventing cross-contamination, separating raw and cooked, using those color-coded tools, cleaning surfaces, cooking food to the right temperature.
Holding temperatures, too, I assume.
Absolutely. Holding food safely, storing it correctly. Remember FIFO? First in, first out, use the older stuff first, and that fridge storage order we talked about. And importantly, cooling down hot food safely, which is often a two-step process.
Right, cooling it quickly to get it out of that danger zone.
Precisely. Then there's cleaning and sanitizing, and they made a point to distinguish them. Cleaning gets rid of visible dirt. Sanitizing actually reduces bacteria to safe levels.
Two different steps.
Yeah, so procedures for cleaning surfaces, equipment, and proper dishwashing, whether it's a machine or the classic 3-compartment sink method.
Makes sense. What about pests?
Pest control. Super important. Keep them out in the first place. Don't leave food or shelter for them inside. And yeah, work with professionals if you need to.
And where the food comes from.
Right. Buying from approved, reputable suppliers. Starts with safe ingredients.
Yeah.
And finally, training and monitoring.
Maybe.
Having clear procedures, training staff continuously, and actually checking that things are being done right using temperature logs, managers observing practices. It's an ongoing process.
Sounds like a complete system, really. Okay, last practical point. For you, listening, if you actually want to look up how a specific restaurant did on its last inspection, how do you do that? Where do you find this info?
Good question. It's not always posted on the door. There are actually several ways you can try it. The most direct is usually your local health department's website.
They have online databases.
Many do, yeah. Sections on food safety or inspections, often searchable by restaurant name. You might find letter grades, summaries, sometimes even full reports. State health department websites can also be useful, especially for comparing across different towns.
Okay, so start with government websites. Anywhere else.
Sometimes, believe it or not, online review sites like Yelp or TripAdvisor might include the health grade on the restaurant's page. It's not consistent, but worth a quick look.
Any other online tools?
Yeah, there are some specialized websites and apps out there specifically designed to track and share health inspection data. Things like iwaspoisoned.com or local ones like dinesafe.org for Toronto might be one specific to your area.
Good to know. What if you strike out online?
You can always just call or email your local health department directly, ask them. They can often provide the info. And sort of the last resort, depending on where you are, you might need to file a Freedom of Information Act request or FOIA request to get the really detailed reports. That can take a bit longer, though.
Okay, so options exist, even if it takes a little digging sometimes. Well, this has been really informative. We've gone from the basics of violations right through to outbreak data and finding reports. What are the main things you hope people take away from this?
I think the biggest thing is just how crucial proactive, consistent food safety is. It's not just about passing an inspection now and then. It's about, a real commitment to keeping people safe, which ultimately helps the business succeed too.
And the transparency matters.
Definitely. We saw how inspections, and especially making those results public, can really drive improvements. And we covered a lot of the common mistakes, both old and new. Hopefully knowing about those helps too. And remember, as a diner, you do have ways to get informed and make choices.
Absolutely. Understanding all this really does make you a more savvy consumer. So maybe here's a final thought to leave you with. How much does knowing about a restaurant's health inspection history actually shape where you choose to eat? Is the current system transparent enough? Or should we be pushing for even easier access to information and maybe more accountability from everyone involved in restaurants and us diners? Something to chew on next time you're browsing menus.